Hello everybody. Today again I'm coming back with Healthy Talk. It is about fever of childs who are under 5. Of course, it is very scary when child has fever, but it is not very uncommon. So please, you have to careful about it and note some of the feature to recognize whether your child needing immediate attention or you can take care of the child at home. So red features means when you need immediate attention is very clear. If you see any of the following, like child become pale, mottled, abnormally cold to touch, or lips are blue, severe breathing difficulty, breathless to talk or even drink, have fit or seizure, very agitated, continuously crying despite distraction, confused, lethargic, and develop a rash that does not disappear on patient. Means with a glass, if you pressure on the rash, it is not disappearing. And any baby under 3 months of age, if the temperature is recorded 38 degrees centigrade or 100.4 degree Fahrenheit or above, unless it is vaccinated and no other features, that is different, but you have to go to the emergency nearby. Now, are less dreadful features, but we call amber signs. Of course, there will be difficulty in breathing, very dehydrated like sunken eye, drowsy, not past urine in 12 hours, and becoming excessively sleepy, very irritable. You cannot settle by toys, TV, food, picking up, and very, very, difficult to arouse. Even if fever is down, still irritable, very, very, shivering extremely, complaining of muscle pain. And if you had the child has chicken pox last few days and getting worse, swelling of limbs and joint, too painful to stand, swollen eyes, continued to have 30 degree or more temperature for more than 5 days. So everything is getting worse. So you should be worried. You have to contact either GP surgery or NHS 111 number. Now, if you don't have any of this following feature, then maybe you can take care of your child. So how can you take care? It has to be, keeping as comfortable as possible. You can give paracetamol or ibuprofen for comfort. Paracetamol 2 months or older for pain and fever, and ibuprofen only above 3 months. Simple food, regular drink. If baby is breastfeeding, continue breastfeeding. If vomitings, offer small frequent drink. Usually they settle down with that. Don't use tepid sponging or fan to cool down the child. Keep an eye on your child in day and night. And fever is very common in babies up to 48 hours after receiving any immunization. So regular paracetamol helps. If the child has vaccination, postpone until fever subsides. And of course, you have to keep the child away from nursery or school while they are unwell and have fever, and then notify your school or nursery. So it is really, really, that child's usually most of the child get very quickly better, but some can get worse. So you have to check regularly in the daytime and also throughout the night. And as it is, I told you, it is very common to have fever and likely your child has some infection. So it is very important to measure the temperature with a digital thermometer. Viral infection is most common. You can see that there will be sneezing, wheezing, sometimes sore throat, eye red. All these things features are there. And if other households also infected, means likely viral infection, and it gets better usually without any antibiotic. So that's all about this fever under 5 years. So if you can keep an eye on your child and assess them accordingly, you can seek medical advice. I think this helps. Hope to talk about something else next time. Bye bye for today.